Third-wave therapies, mindfulness interventions details overview. Third-wave therapies emphasize mindfulness and acceptance to help individuals change their relationship with their thoughts and feelings, rather than directly changing the thoughts themselves. These therapies focus on the present moment and emotional regulation. ACT and acceptance-based approaches focus on accepting difficult thoughts and feelings. Commitment to values-based actions reduce experiential avoidance. DBT and emotional regulation, skills training for managing intense emotions. Focus on mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. Used to treat borderline personality disorder and other conditions involving emotional dysregulation. Therapist's role in changing relationship with thoughts, guide the client to observe thoughts without judgment. Help clients to diffuse from unhelpful thoughts, promote psychological flexibility. Acceptance over avoidance, encourages acceptance of internal experiences. Reduces the struggle against unwanted thoughts and feelings. Promotes engagement in valued activities. Related mental health professions overview. Several mental health professions contribute to the diagnosis and treatment of mental health conditions. These professions utilize different approaches to address the complexities of mental health. Psychiatry, MD, prescription rights, medical doctors specializing in mental health. Can prescribe medication. Focus on biological aspects of mental illness. Biological approaches to treatment, treatments that focus on the biological aspects of mental illness. Typically involves the use of medication and other biological interventions, such as brain stimulation techniques. Evidence on psychotherapy effectiveness overview. Research has shown that psychotherapy is an effective treatment for a variety of mental health conditions, often improving a patient's overall functioning. Several studies have explored the effectiveness of therapy, including how it compares to medication and the impact of session length on outcomes. Meta-analytic findings, psychotherapy improves functioning. Meta-analyses consistently demonstrate that psychotherapy leads to significant improvements in mental health. Patients often experience reduced symptoms and enhanced quality of life. Medication versus therapy combinations, research often compares psychotherapy to medication or a combination of both. Combining therapy and medication can be more effective than either treatment alone for some conditions. The choice of treatment or combination depends on the specific condition and individual needs. Session duration and outcomes, the length of therapy sessions and the overall duration of treatment can influence outcomes. Studies examine the optimal session length and overall treatment duration to maximize therapeutic benefits. Factors like the type of therapy and the severity of the condition can affect the relationship between session duration and outcomes. DSM-5 disorder categories, overview. Overview, the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5th edition, organizes mental disorders into various categories to facilitate diagnosis and treatment. This structured approach helps clinicians classify and understand the diverse range of mental health conditions. Neurodevelopmental disorders, schizophrenia spectrum and psychotic disorders, mood disorders, bipolar, depressive anxiety disorders, obsessive-compulsive and related disorders, trauma and stressor-related disorders, dissociative disorders, somatic symptom and related disorders, feeding and eating disorders, elimination, sleep-wake disorders, sexual dysfunctions, gender dysphoria, disruptive, impulse control, and conduct disorders, substance-related and addictive disorders, neurocognitive disorders, personality disorders, paraphilic disorders, other mental disorders, mindfulness-based interventions, MBSR. Overview, mindfulness-based stress reduction, MBSR, is an 8 to 10 week program designed to teach mindfulness skills for managing stress, pain, and illness. It utilizes meditation practices and group settings to foster self-awareness and emotional regulation. 8 to 10 week program structure, typical duration of MBSR programs. Structured curriculum with sequential sessions. Stress reduction and coping, teaches skills to manage stress. Enhances coping mechanisms for challenging situations. Meditation practices, includes various mindfulness meditation techniques. Focuses on present moment awareness. Clinical efficacy for pain, anxiety, depression, demonstrates effectiveness in reducing symptoms. Supports improved well-being. Group delivery and homework components, the program is often delivered in a group setting. Homework assignments to reinforce learning and practice outside of sessions. Common therapeutic factors overview. Common therapeutic factors are elements present across different therapeutic approaches that contribute to positive outcomes in therapy. These factors are crucial for successful treatment and patient well-being, influencing the therapeutic process and client progress. Therapeutic alliance, definition, the collaborative relationship between the therapist and the client. Importance, it involves trust, empathy, and agreement on goals and tasks. Impact, a strong alliance is consistently linked to better therapeutic outcomes. Supportive factors and relationship components include empathy, warmth, genuineness, and acceptance from the therapist. Benefits, helps the client feel understood, safe, and validated. Outcome, builds a strong therapeutic relationship which improves outcomes. Learning factors, insight, corrective emotional experience, insight, gaining a better understanding of one's thoughts, feelings, and behaviors. Corrective emotional experience, providing a new emotional experience that helps clients challenge and modify maladaptive beliefs and patterns. Impact, facilitates change by promoting self-awareness and emotional processing. Action factors, mastery, risk-taking, modeling, mastery, encouraging clients to take steps and build competence. Risk-taking, creating a safe space for clients to try new behaviors. Modeling, the therapist demonstrating and teaching new behaviors. Outcome, promotes personal growth and behavior change. Reality testing and exposure to fears, reality testing, helping clients evaluate the accuracy of their perceptions and beliefs. Exposure, confronting fears in a safe, controlled environment. Result, this can lead to increased coping skills and reduced anxiety and avoidance. Humanistic psychology overview, humanistic psychology is a psychological perspective that emphasizes the study of the whole person. It focuses on human potential, self-actualization, and the importance of subjective experience. Carl Rogers and AMP, client-centered therapy, key figure in humanistic psychology. Developed client-centered therapy, also known as person-centered therapy. Emphasizes the client's capacity for self-direction and understanding. Unconditional positive regard, UPR, acceptance and respect for a person regardless of their behavior. A core condition for therapeutic progress in client-centered therapy. Allows clients to explore and accept their feelings without judgment. Accurate empathy, the ability to deeply understand another person's experiences and feelings. Therapists strive to see the world from the client's perspective. A key component of effective therapeutic relationships. Congruence, a state of being genuine and authentic. The therapist's consistency between their feelings, thoughts, and behaviors demonstrates honesty and openness in the therapeutic relationship. Actualization tendency, an innate drive to grow, develop, and reach one's full potential. The inherent motivation to become the best version of oneself. A fundamental concept in humanistic psychology. Adaptive growth and the role of positive regard. Positive regard from others is important for fostering growth. Conditional positive regard can hinder growth. Unconditional positive regard promotes adaptive growth and self-acceptance. Reflection as a therapeutic communication technique. Therapists reflect the client's feelings and experiences back to them. Helps clients gain clarity and self-awareness. Supports the client's exploration of their thoughts and emotions. Doctor of Psychology focus and characteristics. Overview. A Doctor of Psychology, degree is a practice-oriented doctoral degree in psychology, emphasizing clinical skills and professional practice over research. It is designed to prepare psychologists for direct service roles, such as clinical practice. Clinical skills emphasis focuses on the development of clinical competencies. Training prioritizes practical experience. Includes extensive clinical coursework and supervised practicum experiences. Less research emphasis. Research training is present, but less intensive than in a PhD program. The focus is on applying research to clinical practice rather than generating new research. Dissertation versus professional subject may involve a dissertation, but it may be less research intensive. Some programs may offer a professional project instead of a dissertation. Shorter training duration, often designed to be completed in a shorter timeframe than a PhD program. Program availability, offered at various universities and professional schools. Availability may vary depending on the specific area of psychology. Self-talk and inner dialogue overview. Self-talk and inner dialogue refer to the internal conversations individuals have with themselves, which can influence their thoughts, feelings, and behaviors. This internal dialogue can either be positive and supportive or negative and self-critical, impacting various aspects of life. Inner speech and rumination. Definition of inner speech and how it functions. Distinction between inner speech and rumination. Characteristics and patterns of rumination. Impact on mood and relationships. How self-talk affects emotional states, such as happiness, sadness, and anxiety. Influence of self-talk on interpersonal communication and relationships. Strategies for using self-talk to manage and improve mood. Self-criticism and cognitive biases. Identification of common cognitive biases that contribute to negative self-talk. How self-criticism arises and its impact on self-esteem and mental health. Examples of how to recognize and challenge negative thought patterns. Strategies to reframe self-talk. Techniques for identifying and modifying negative self-talk. Methods to cultivate more positive and supportive inner dialogues. Practice of mindfulness and how it can affect self-talk. Beliefs as hypotheses and hypothesis testing overview. This concept involves viewing personal beliefs as hypotheses that can be tested through real-world experiences. It encourages individuals to challenge their beliefs through experiments and evaluate the impact of these challenges on their emotional state and actions. Treating beliefs as testable propositions, formulating beliefs in a way that allows for falsification. Identifying predictions that follow from a belief. Recognizing the evidence that would support or contradict a belief. Real-life experiments to challenge beliefs, designing and conducting experiments to test the validity of a belief. Gathering and analyzing data from these experiments. Modifying or rejecting beliefs based on experimental results. Impact of challenging irrational beliefs on mood and behavior, assessing how challenging beliefs affects emotional well-being, for example, anxiety, depression. Observing changes in behavior resulting from updated beliefs. Understanding how testing beliefs can improve decision-making and overall mental health. DSM and diagnostic systems. Overview. The Diagnostic and Statistical Manual of Mental Disorders, DSM, is a widely used classification and diagnostic tool in mental health. It provides criteria for diagnosing mental disorders, which have evolved over time with revisions such as the shift from the DSM-4TR to DSM-5. DSM-5 changes, no multiaxial system, V codes, functional status versus symptoms, key changes from previous versions. A removal of the multiaxial system, which was used to provide a comprehensive assessment across different domains. Introduction of V codes to denote conditions that may be a focus of clinical attention but are not mental disorders. Greater emphasis on assessing functional status in addition to symptoms. Dimensional approaches to disorders, exploration of the use of dimensional approaches in classifying mental disorders. This approach considers the severity and characteristics of symptoms along dimensions rather than solely relying on categorical diagnoses. DSM-4TR structure and axes. Overview of the structure of the DSM-4TR, which was used before the DSM-5. Explanation of the multiaxial system used in DSM-4TR, which included axes for different aspects of a patient's condition, for example, clinical disorders, personality disorders, medical conditions. Clinical psychology training and credentials overview. Clinical psychology training involves doctoral level education, emphasizing both research and clinical practice. It prepares professionals for independent practice, research, and teaching in the field, requiring specific training experiences and licensure. PhD in clinical psychology, doctoral degree is the standard requirement for independent practice. Involves coursework, research, and clinical training. Typically takes 5 to 7 years to complete. Scientist practitioner model, Boulder, training model emphasizing the integration of scientific research and clinical practice. Graduates are expected to be both producers and consumers of research. This model prepares psychologists to evaluate research and to conduct their own research to inform their practice. Practicum and internships, pre- and postdoctoral, practicum, supervised clinical experience during doctoral training. Pre-doctoral internship, full-time, supervised clinical experience, typically 1 year in length, taken towards the end of the doctoral program. Postdoctoral internship, further supervised clinical experience after the doctoral degree, often required for licensure. Licensure and SEUS, EPPP, licensure, required to practice independently as a clinical psychologist. Requires a doctoral degree, supervised clinical experience, and passing an exam, EPPP. EPPP, examination for professional practice in psychology, standardized exam used for licensure. SEUS, continuing education units, required for license renewal, to maintain professional competence, and to stay current with the field. Third wave therapies and mindfulness overview. Third-wave therapies integrate mindfulness practices with cognitive and behavioral techniques to promote psychological flexibility and well-being. These therapies emphasize acceptance of experiences and present moment awareness, shifting focus from thought content to the process of experiencing. Mindfulness definition and present moment focus. Mindfulness involves paying attention to the present moment without judgment. This includes awareness of thoughts, feelings, bodily sensations, and the surrounding environment. Cultivating present moment focus is key to many third-wave approaches. Non-judgmental acceptance of experience encourages accepting thoughts and feelings without trying to change or suppress them. This involves observing experiences as they arise, rather than getting caught up in reacting to them. Acceptance reduces the struggle with internal experiences, decreasing suffering. Impact on emotion regulation and distress. Mindfulness skills help individuals to identify and observe emotions without being overwhelmed. This can lead to improved emotional regulation, reducing the intensity and duration of distressing experiences. Reduces emotional reactivity and promotes a more balanced response to challenging situations. Urge surfing and application to addiction. Urge surfing is a technique used in addiction treatment. It involves observing urges without acting on them, like surfing a wave. Mindfulness helps individuals to ride the wave of the urge without getting swept away by it, leading to increased control and reduced substance use. ACT, acceptance and AMP, commitment therapy. ACT combines acceptance and mindfulness strategies with commitment to values-based action. The goal is to increase psychological flexibility to live a more meaningful life, even in the presence of difficult thoughts and feelings. Focuses on clarifying personal values to guide behavior. DBT, dialectical behavior therapy. DBT is designed to treat individuals with emotion dysregulation, particularly those with borderline personality disorder. Integrates mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness skills. Emphasizes a balance between acceptance and change. Mindfulness-based stress reduction, MBSR, an 8-week program that teaches mindfulness meditation and yoga. It is designed to reduce stress, pain, and improve overall well-being. Participants learn to cultivate present moment awareness through guided practices and group discussions. Mindfulness as core to therapy rather than disputing thoughts. Third-wave therapies often view thoughts as mental events to be observed, rather than facts to be debated. The emphasis is on changing the relationship to thoughts, rather than trying to change the thoughts themselves. Mindfulness helps individuals to detach from their thoughts, reducing their impact on behavior and mood. Aaron Beck's Cognitive Theory and Distortions Overview. Aaron Beck's cognitive theory posits that psychological distress stems from maladaptive thought patterns. It focuses on identifying and modifying these distorted thoughts to alleviate symptoms and improve well-being. Cognitive schemas and the cognitive triad, self/world/future. Cognitive schemas are core beliefs that influence how individuals perceive and interpret the world. The cognitive triad involves negative views about oneself, the world, and the future. Automatic thoughts. These are spontaneous, often negative, thoughts that arise in response to situations. They are a key target for cognitive restructuring in therapy. Cognitive distortions. These are systematic errors in reasoning that lead to negative or unhelpful thoughts. Examples include magnification, exaggerating the importance of negative events. Catastrophizing, assuming the worst possible outcome. Dichotomous thinking, viewing things in extremes, for example, all or nothing. Personalization, taking responsibility for events that are not related to you. Shoals, having rigid expectations or rules. Mind reading, assuming you know what others are thinking. Fortune telling, predicting the future negatively. Emotional reasoning, believing that something must be true because you feel it. Labeling, attaching negative labels to oneself or others. Dysfunctional thought record, DTR, a tool used to identify, challenge, and modify negative automatic thoughts. It typically involves recording situations, associated automatic thoughts, emotions, and alternative responses. Empirical support for CBT, cognitive behavioral therapy, CBT, based on Beck's theory, has strong empirical support for its effectiveness in treating various mental health conditions. Research supports the use of CBT as a treatment. Therapeutic alliance and empathy. A strong therapeutic alliance, characterized by trust and collaboration, is essential for successful CBT. Empathy from the therapist helps create a supportive environment for the client. Hypotheses as beliefs and testing through real-life experiments. CBT encourages clients to view their negative thoughts as hypotheses. Clients test these hypotheses through behavioral experiments in real-life situations. Dissociative disorders and dissociative identity disorder overview. Dissociative disorders involve disruptions in a person's consciousness, memory, identity, or perception of the environment. Dissociative identity disorder, DID, a specific type of dissociative disorder, is characterized by the presence of two or more distinct personality states. Dissociation, defined as a disruption in the usually integrated functions of consciousness, memory, identity, or perception, can manifest as feeling detached from one's body, depersonalization, or the surrounding environment, derealization. Dissociative identity disorder, DID, a mental disorder characterized by the presence of two or more distinct personality states, alters. These alters repeatedly have control over a person's behavior. Alters/personalities, memory, identity, skills. Each alter has its own patterns of perceiving, relating to, and thinking about the environment and self. Alters may have different memories, identities, and skill sets. Variations in memory recall between alters are common. Switching between alters, the process of changing from one personality state to another, can be triggered by stress, trauma, or other environmental cues. Switching can occur suddenly or gradually. Prevalence and diagnostic controversies. The exact prevalence of DID is debated due to diagnostic challenges. Some argue that DID is overdiagnosed, while others believe it is underdiagnosed. Diagnostic criteria and assessment methods are subjects of ongoing discussion. DID symptoms and onset. Symptoms include memory gaps, identity confusion, and changes in self-perception. Onset is often associated with severe trauma in childhood. Other symptoms may include depression, anxiety, and self-harm. Mood disorders overview. Mood disorders are a group of mental health conditions characterized by significant disturbances in mood, affecting emotions, thoughts, and behaviors. They encompass a range of conditions from depressive disorders to bipolar disorders, each with distinct features and treatment approaches. Depressive disorders, major depression, characterized by persistent feelings of sadness, loss of interest or pleasure, and other associated symptoms. Disruptive mood dysregulation. This involves chronic, severe irritability and temper outbursts in children and adolescents. Bipolar disorders involve periods of both elevated mood, mania or hypomania, and depressive episodes. Clinical features, depressed mood, anhedonia. Common symptoms include depressed mood, loss of interest or pleasure, anhedonia, changes in sleep, appetite, and energy levels. Course, prognosis, and treatment considerations. The course of mood disorders varies, with some experiencing single episodes and others recurrent episodes. Treatment often involves medication, psychotherapy, or a combination of both. DSM framework changes impacting mood diagnoses. Diagnostic criteria and classifications of mood disorders are outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM. Changes in the DSM can influence how mood disorders are diagnosed and treated. Trauma and stressor-related disorders overview. Trauma and stressor-related disorders are a group of mental health conditions that arise following exposure to a traumatic or stressful event. These disorders involve specific diagnostic criteria and can significantly impact an individual's functioning and well-being. Post-traumatic stress disorder, PTSD, characterized by specific diagnostic criteria related to exposure to a traumatic event. It involves a range of symptoms, including intrusive memories, avoidance behaviors, negative alterations in cognition and mood, and alterations in arousal and reactivity. It can significantly impact daily functioning and quality of life. Traumatic memories, haunting memories, nightmares, intrusive and distressing memories related to the traumatic event. May manifest as nightmares, flashbacks, or intrusive thoughts. Can contribute to the overall distress and impairment associated with the disorder. Symptoms and onset/duration after trauma. Symptoms can vary widely but often include re-experiencing the trauma, avoidance of triggers, negative thoughts and feelings, and increased arousal. Onset of symptoms can occur shortly after the trauma or may be delayed. Duration of symptoms can vary, with some individuals experiencing chronic symptoms and others showing improvement over time. Abnormal behavior and classification overview. Abnormal behavior is defined and classified within the field of psychology to understand, diagnose, and treat various psychological disorders. This involves establishing criteria for what constitutes abnormal behavior and using classification systems to categorize and organize these behaviors. Definitions of abnormal behavior. Criteria are used to define what is considered abnormal, including statistical infrequency, deviance, distress, dysfunction, and danger. Different definitions emphasize different aspects, such as statistical rarity, social nonconformity, personal suffering, impairment in daily functioning, and potential harm to self or others. DSM classifications, DSM-4TR versus DSM-V relationship. DSM, Diagnostic and Statistical Manual of Mental Disorders, is the primary classification system used in North America. DSM-4TR was a revision of DSM-4, with minor text changes. DSM-V, published in 2013, represents a major revision, with some disorders reclassified or new disorders introduced. Significant changes include the removal of the multi-axial system and the integration of dimensional assessments. Overview of psychological disorder classification. Psychological disorders are grouped based on shared symptoms and underlying causes. Classification systems aim to provide a common language and framework for diagnosis, research, and treatment. The classification system is continually revised to reflect new research findings and improve diagnostic accuracy. Schizophrenia spectrum and psychotic disorders overview. Schizophrenia spectrum and psychotic disorders encompass a range of conditions characterized by abnormalities in one or more of the following 5 domains: delusions, hallucinations, disorganized thinking speech, grossly disorganized or abnormal motor behavior, including catatonia, and negative symptoms. These disorders significantly impair a person's ability to perceive reality, think clearly, manage emotions, make decisions, or relate to others. Positive symptoms, delusions, hallucinations. Delusions are fixed beliefs that are not amenable to change in light of conflicting evidence. Hallucinations are perception-like experiences that occur without an external stimulus. Negative symptoms, avolition, anhedonia, allergia. Avolition is a decrease in motivated self-initiated purposeful activities. Anhedonia is the decreased ability to experience pleasure from positive stimuli or a degradation in the recollection of pleasure. Allergia is manifested in the form of diminished speech output. Disorganized thinking. Disorganized thinking is typically inferred from the individual's speech. Speech may be disjointed, illogical, and difficult to follow. Psychomotor symptoms. Psychomotor symptoms include catatonia, which is a marked decrease in reactivity to the environment. Symptoms can range from stupor to excessive and purposeless motor activity. Course and prognosis. The course of schizophrenia varies, but often involves episodic periods of acute symptoms interspersed with periods of relative stability. Prognosis depends on various factors, including the severity of symptoms, access to treatment, and social support. Diagnostic criteria refinements, DSM. The Diagnostic and Statistical Manual of Mental Disorders, DSM, provides specific criteria for diagnosing schizophrenia spectrum disorders. Criteria are regularly updated to reflect the latest research and improve diagnostic accuracy. Obedience and compliance overview. Obedience and compliance are social psychological concepts that explain how individuals change their behavior in response to requests, orders, or social norms. They are fundamental to understanding social influence and group dynamics. Milgram experiments and ethical considerations focuses on the study of obedience to authority figures, specifically through the use of electric shocks. Raising ethical concerns about deception, psychological distress, and the right to withdraw. Obedience to authority examines how individuals conform to the commands of an authority figure. Discusses factors that increase or decrease obedience, such as the perceived authority of the figure, the proximity to the victim, and the location of the experiment. Compliance techniques, Cialdini. Explores strategies people use to persuade others to comply with requests, based on principles outlined by Robert Cialdini. Foot in the door involves gaining compliance by first making a small request, followed by a larger, related request. Uses consistency as a psychological principle. Door in the face involves starting with a large request that is likely to be rejected, followed by a smaller, more reasonable request. Exploits the norm of reciprocity. Norms and reciprocity explains the influence of social norms and the tendency to reciprocate favors or concessions. Discusses how these factors can be leveraged to increase compliance. Reasoning based on cognitive dissonance explores how individuals resolve the discomfort caused by conflicting beliefs, attitudes, or behaviors. Discusses how cognitive dissonance can be used to influence behavior. Influence of authority, proximity, legitimacy. Examines how the authority of the requester, the physical proximity of the requester to the subject, and the perceived legitimacy of the authority impact obedience and compliance. Discusses how these factors can significantly alter the likelihood of individuals complying with requests or orders. Evolutionary and gendered theories of attraction overview. Evolutionary and gendered theories of attraction explore how mate preferences and relationship dynamics are shaped by evolutionary pressures and gender-specific reproductive strategies. This includes understanding the biological and psychological factors that influence attraction and mate selection. Evolutionary Foundations of Mate Preferences, BUS, examines how mate preferences have evolved to maximize reproductive success. Highlights the role of universal preferences, such as those related to health, resources, and fertility, that increase the likelihood of successful reproduction and offspring survival. Male versus female reproductive strategies. Explores the differences in reproductive strategies between males and females due to differing biological constraints and parental investment. Males may prioritize quantity, number of partners, to maximize the spread of their genes, whereas females may prioritize quality, partners' resources, commitment, due to higher investment in offspring. Gender differences in jealousy and mate selection. Addresses the different triggers and expressions of jealousy in men and women, often linked to concerns about paternity uncertainty, men, and resource loss, women. Explores the contrasting priorities in mate selection, with men often emphasizing physical attractiveness and youth, while women may prioritize resources, status, and commitment. Social influence and conformity. Overview. Social influence encompasses how an individual's thoughts, feelings, and behaviors are affected by the presence of others, whether real or imagined. Conformity, a key aspect of social influence, involves adjusting one's behavior or thinking to align with a group standard. Definition and types of social influence. It includes various processes by which individuals change their thoughts, feelings, or behaviors due to the influence of others. Types of social influence include conformity, compliance, and obedience. Informational versus normative influence. Informational influence, accepting information from others as evidence about reality. Normative influence, conforming to be liked or accepted by others. Conformity, private acceptance versus public compliance. Private acceptance, truly believing the group's perspective. Public compliance, outwardly agreeing without necessarily believing. Situational factors affecting conformity. Group size, conformity increases with the size of the group, but the effect plateaus. Unanimity, conformity decreases if there is any dissent in the group. Task difficulty, the more ambiguous the situation, the greater the conformity. Classic experiments. Sharif's experiment, examined informational social influence using the autokinetic effect. Ash's experiment demonstrated normative social influence using line judgments. Impact of norms and group dynamics. Social norms, shared expectations about how people should think, feel, and behave. Group cohesiveness, the degree to which group members are attracted to each other and want to stay in the group. Group status, higher status individuals are often more influential. Least to most coercive continuum, a spectrum of social influence ranging from subtle forms, for example, persuasion, to overt pressure, for example, obedience. Includes techniques like foot in the door in the face, and the lowball effect. Cognitive dissonance theory. Overview. Cognitive dissonance theory describes the mental discomfort experienced when holding conflicting beliefs, values, or attitudes. This theory explains how individuals strive to reduce this discomfort, often by changing their attitudes, behaviors, or rationalizing the inconsistencies. Definition. Behavior-attitude inconsistency focuses on the psychological tension arising when behaviors clash with existing attitudes or beliefs. This inconsistency creates a state of cognitive dissonance, motivating individuals to seek consistency. Motives to reduce dissonance. The primary motivation is to alleviate the psychological discomfort caused by the inconsistency. Individuals are driven to restore cognitive consonance and maintain a sense of internal consistency. Resolution strategies. Change behavior, change attitude, rationalize, changing behavior, altering actions to align with attitudes or beliefs. Changing attitude, modifying internal beliefs to match behavior. Rationalizing, justifying the inconsistency through external factors or creating new cognitions. Subtypes. Insufficient justification, post-decision dissonance, initiation effects. Insufficient justification occurs when individuals perform actions that conflict with their beliefs without sufficient external justification. Post-decision dissonance arises after making a difficult choice between two or more options. Initiation effects describes the commitment to a group or activity through a gradual escalation of effort or commitment. Methodological considerations and examples. For example, smoking explores how research is designed to test the predictions of dissonance theory. Smoking is a common example where the behavior, smoking, is inconsistent with the knowledge of its negative health effects. Applied dissonance reduction in decision-making demonstrates how individuals use cognitive dissonance to make decisions and justify choices. Dissonance reduction influences how people evaluate alternatives and commit to their decisions. Relationships, attraction, and social exchange overview. This topic explores the dynamics of human relationships, covering how attraction forms, how individuals select partners, and the social and psychological processes that influence relationship development and maintenance. Marketplace theory and mate selection examines how individuals evaluate potential partners based on perceived assets and liabilities. This theory suggests that individuals seek partners who offer the best value in terms of desirable traits and resources. Michelangelo phenomenon focuses on how partners can sculpt or influence each other to become closer to their ideal selves. Involves partners supporting and encouraging each other's personal growth and development. Communal versus exchange relationships. Exchange relationships, interactions are governed by a focus on equity and reciprocity. People keep track of contributions and expect to receive comparable benefits. Communal relationships, interactions are governed by a concern for the other person's needs. People give and receive benefits based on need, without expecting immediate reciprocation. Jealousy and infidelity theories. Double shot theory explores the causes and consequences of jealousy and infidelity in relationships. Double shot theory suggests that people may be more upset by emotional infidelity, for example, falling in love with someone else because they see it as implying sexual infidelity, and vice versa. Conflict patterns. Demand/withdraw. Describes a common dynamic in which one partner demands discussion or change, while the other withdraws from the conversation. This pattern often leads to increased conflict and decreased relationship satisfaction. Appearance, desirability cues in relationships, investigates how physical appearance and other cues influence initial attraction and relationship formation. Explores the role of attractiveness, grooming, and other signals in mate selection and relationship dynamics. Visualization overview. Visualization is a cognitive technique involving the creation of mental images to improve performance and achieve goals. It is used in various fields to enhance skills, manage anxiety, and boost overall readiness. Mental rehearsal of skills involves mentally practicing actions or tasks. Improves performance and skill acquisition by simulating real-world scenarios in the mind. Neural activation similar to physical practice, brain activity during visualization mirrors that of physical execution. Strengthens neural pathways involved in the skill. Builds confidence, focus, readiness. Visualization enhances self-assurance and mental preparedness. Improves focus by mentally simulating the desired outcome. Guided imagery, a form of visualization guided by an instructor or audio. Helps individuals create specific, detailed mental images. Pink elephant effect. The more you try not to think about something, the more you end up thinking about it. Visualization can backfire if used to suppress unwanted thoughts. Focusing on the negative can increase its presence. Motivation overview. Motivation is the driving force behind our actions, influencing the initiation, direction, intensity, and persistence of behavior. It can originate from internal factors, intrinsic, or external factors, extrinsic, and it fluctuates over time. Intrinsic versus extrinsic motivation. Intrinsic motivation stems from internal factors such as enjoyment, interest, or a sense of accomplishment. Extrinsic motivation arises from external rewards or the avoidance of punishment. Fluctuation in motivation. Motivation is not static and changes over time. Factors like interest, environmental conditions, and the presence or absence of rewards and punishments can cause motivation to fluctuate. Goal adjustment and meaning making. Motivation is influenced by the goals we set and how we perceive the meaning of our actions. Adjusting goals and finding personal meaning in activities can impact motivation. Balancing intrinsic versus extrinsic motivation. Understanding the interplay between intrinsic and extrinsic motivators is important. Over-reliance on extrinsic rewards can sometimes undermine intrinsic interest, and finding a balance is often optimal for sustained motivation. Arousal management overview. Arousal management involves techniques to regulate physiological and psychological activation levels. It aims to help individuals cope with stress and enhance performance by controlling the body's response to various stimuli. Nerves and pressure regulation focuses on the interplay between the nervous system and the regulation of pressure within the body. Understanding how nerves influence bodily functions and how to manage pressure-related responses. Physiological and psychological activation addresses the body's physical responses, for example, heart rate, muscle tension, and mental states, for example, alertness, anxiety strategies to modulate both physiological and psychological components of arousal. Autonomic nervous system changes. Examines the role of the autonomic nervous system, ANS, including the sympathetic and parasympathetic branches, in arousal regulation. Techniques to influence the ANS and promote a balanced response to stress. Breathing, reframing, and routines emphasizes the use of breathing exercises, cognitive reframing, and established routines. These techniques help in managing arousal levels through controlled breathing, changing perspectives, and creating predictable behaviors. Stress mindset focuses on developing a positive and adaptive mindset towards stress. Involves strategies to view stress as a challenge rather than a threat, thereby promoting resilience and effective arousal management. 7 foundational concepts overview. The 7 foundational concepts are key psychological skills that can be used to improve performance and achieve goals. These concepts encompass mental and emotional strategies for enhancing focus, motivation, and overall well-being. Mental toughness, ability to cope with stress and pressure. Involves resilience and perseverance. Confidence, belief in one's abilities. Impacts performance and decision-making. Concentration, focus and attention. Minimizing distractions to maintain focus. Goal setting, establishing specific, measurable, achievable, relevant, and time-bound, SMART objectives. Provides direction and motivation. Motivation, internal drive to achieve goals. Maintaining enthusiasm and commitment. Visualization, mental imagery to simulate experiences. Enhances preparation and performance. Arousal management, controlling levels of physiological and psychological activation. Optimizing performance by regulating excitement and anxiety. Mental performance and psychological skills. Overview, mental performance and psychological skills are crucial for optimizing performance in various domains. This includes developing focus, confidence, and resilience, as well as managing stress and utilizing techniques like visualization to enhance performance. Psychological skills, focus, confidence, resilience, developing and maintaining focus. Building and sustaining self-confidence. Cultivating resilience to overcome challenges and setbacks. Concentration and attention control, strategies for improving concentration. Techniques for managing distractions. Methods for shifting and sustaining attention. Goal setting and motivation, setting effective goals. Strategies for enhancing and maintaining motivation. The role of self-efficacy in goal achievement. Visualization and imagery, utilizing imagery to enhance performance. Types of imagery, for example, visual, kinesthetic. The role of imagery in skill acquisition and performance enhancement. Arousal regulation and stress management, techniques for managing arousal levels. Stress management strategies. Coping mechanisms for dealing with pressure. Application to high-stakes environments, strategies for performing under pressure. Maintaining composure in high-stakes situations. The role of mental preparation in high-stakes environments. Transfer to non-sport domains, military, medical, business, arts, applying mental performance skills outside of sports contexts. The use of psychological skills in various professional fields. Adaptation of techniques to suit different environments and needs. Sport Psychology Foundation's overview. Sport psychology applies psychological principles to enhance athletic performance, address mental health issues in athletes, and understand the psychological aspects of exercise and physical activity. It encompasses various areas, including performance enhancement, mental well-being, and the psychological impact of sport and exercise. Definition and scope of sports psychology explores the mental factors that influence and are influenced by participation in sports and exercise. It includes performance enhancement, mental well-being, and the psychological aspects of exercise and physical activity. Mind-body connection in performance focuses on the interplay between psychological states and physical performance. Emphasizes the role of mental skills, such as visualization, in improving athletic outcomes. Mental health versus mental performance distinguishes between addressing mental health concerns and enhancing mental skills for performance. Mental health involves emotional well-being, while mental performance focuses on optimizing cognitive and psychological skills for athletic success. Evidence-based foundations across psychology disciplines. Integrates theories and research from various psychology fields, such as cognitive, social, and developmental psychology. Utilizes empirical evidence to guide interventions and practices in sports psychology. Historical roots and applications beyond sport, examines the evolution of sports psychology as a field, including key figures and milestones. Highlights the application of sports psychology principles in non-sport settings, such as business and education. Mental health in sport overview. Mental health in sports encompasses the psychological well-being of athletes and the factors that influence it. It addresses the prevalence of mental health issues, obstacles to seeking help, the impact of stigma and confidentiality, the role of support staff, and strategies for promoting well-being. Prevalence of anxiety and depression among athletes, key statistics on the rates of anxiety and depression in athletes. Comparison of prevalence rates with the general population. Factors contributing to increased risk. Barriers to seeking help, common obstacles that prevent athletes from seeking mental health support. The impact of performance pressure on help-seeking behavior. Financial and logistical barriers. Stigma and confidentiality, the impact of stigma on athletes' willingness to seek help. Importance of maintaining confidentiality in mental health care. Strategies to reduce stigma within the sports community. Role of athletic staff, coaches, trainers, teammates, in support, responsibilities of coaches and trainers in recognizing mental health issues. The role of teammates in providing support and encouragement. Training and education for staff on mental health awareness. Strategies to promote help-seeking and well-being, mental health promotion programs and initiatives. Creating a supportive team environment. Resources and services available for athletes. Importance of early intervention and preventative measures.